She's an associate professor with Athabasca University, chair of the Ontario Cancer Research Ethics Board, and the co-lead of the Canadian Nursing and Genomics Group. Her research examines inter and intra-professional collaboration and the impact of technology and knowledge such as genomics on clinical practice. Dr. Limoges is dedicated to forming networks of collaboration and supporting leaders to exchange quality patient care and advancing in nursing practice. Welcome, Jacqueline.
Thank you very much. Are you able to see my slides and hear me?
Yes.
Okay, very good. Well, thank you very much. It is truly a pleasure to be here speaking at your conference and to share some of the Canadian nursing experience. And it was really lovely to hear Kathy Calzone's presentation and to get to know more about Kathy. We've known each other for a few years, and some of what she described as a new story. And Kathy, once again, thank you for pitch hitting. I somehow must have got the time mixed up a little bit for the start time. So really grateful that you were there and could get started. So I will move then to the next slide. And I'd like to begin as we do in Canada. So we are in the process of a reconciliation project with our Indigenous people here in Canada. And we begin all presentations every time we speak by acknowledging the land that we're on. And I happen to be on a small vacation right now in British Columbia near Tofino, so you can Google that. So I'm on the Pacific coast, and normally I reside in Ontario, so you can see how far I've come and yet how far we are from Spain. So I would like to respectfully acknowledge the unceded traditional territory of the Tlahuquit First Nation of the Nuu people and the traditional keepers of their land. I say thank you for allowing me to work and play on your lands near Tofino, British Columbia. So with the land acknowledgement said and recognizing the global reach of nursing and what a pleasure it is to have an opportunity to give back to so many of you who are at this conference in ways that you contributed to our initiative. So what I'm going to be speaking with you about in the next 20 minutes is to explore the contributions of an engagement framework that we created here in Canada to guide all of our initiatives supporting nurses to engage with the development of genomic literacy and genomic-informed practices. We are still very much at the beginning of our journey, and we've been engaged in this work for coming on to 3 years. And so you'll hear about the gains that we've made, some of the challenges that we've had, but how this engagement framework has been so important to what we've tried to do here. And then I want to have a chance to speak with you about some of the specific leadership strategies that we've used, getting to objective number 3, where hopefully there will be something that I say that either stimulates an idea for you or something maybe that we've done here in Canada that resonates with what you're trying to do in your country and hopefully be of use. As Kathy has indicated, the community in nursing and genomics is very collaborative, and we have greatly benefited from those who did this work ahead of us in Canada. And so hopefully we can give back a little bit. So I just want to talk a little bit about some of the background and how we started this. I was teaching ethics, so my specialty is really in the ethics of genomics. And I was teaching ethics back in 2000 when a special issue in the Journal of Nursing Ethics came out on all of the ethical considerations with genetics. And for those of you who have heard me speak before, you'll know that I looked at that whole issue and I thought, well, what is this anyway? And how could an entire issue be produced on something that I really know nothing about? And so since that time, every time I would do the literature searches in preparation for my ethics classes, I would see more and more and more being written. And so my curiosity was piqued. What does this mean for us as nurses? Because our practice globally as nurses is founded on an ethical and a moral framework. And so Really important for me to try to understand some of this. And then when I became chair of the Ontario Cancer Research Ethics Board, that's the board that does the ethics review and permits all of the high-risk cancer clinical trials to move forward in our province. Every month at these meetings, I would see more and more genetic research. And I started wondering, where is nursing in this? And so that's how my colleague, Lindsay Carlson, and I, who has a lot of scientific expertise in genomics, that's how we started to recognize just the magnitude of what needed to happen in Canada, and then eventually globally, to support nurses to engage with this. Because our strong belief, and it continues, is that nurses are key to the safe and ethical integration of genomics and precision healthcare for enhanced health. Our view is that with 44% of the workforce engaged in this project, or alternatively not engaged, it won't unfold in the way that it needs to unfold to make sure that everyone benefits from genomics. And so all of my work for probably the last 20 years has been founded on this principle of nursing intra-professional collaboration. I have noticed every time I've tried to do a big project or a small project, that when nurses work together collaboratively, so much more is possible. I also understood very quickly, with the magnitude of what needed to happen in Canada around nursing and genomics, that we would need nurses from the 5 domains of practice to participate. We would need nurses doing research to develop the body of evidence to guide our practice. We would need administrators to help create the new care pathways, to support staff to make changes in practice. We would need nurses in education to educate the workforce, either pre-entry into the workforce in the bachelor programs, or as nurse educators and in master's and PhD programs. The nurses who write policy would be really important, because policy statements are these public documents that declare what we're responsible for as nurses. It tells the public what they can expect from us. And it also sets standards for us as nurses so that we know what it is that we're supposed to be doing. And of course, nurses at the point of care, collaborating with them was so important to understand where they're at and what they need, so that our strategies are tailored to them. And the other thing that I knew, and again from reading the literature, is that there was a need for clear priorities and concerted leadership strategies. When there's something as big as supporting, in Canada, it's 440,000 nurses, to develop new knowledge, new skills, new competencies, it's important that the project be very organized and that the pieces all fit together so that things unfold in an important way. So the other thing that I know, and I think that is really important for us to think about globally, is that knowledge activates social processes and that it's never neutral. And so by this, what I mean is that knowledge forms create different ways that people interact with each other. They create different social processes, different sort of social interactions. And right now, and for the past several years, and I think moving forward, there's this sense that genetic and genomic knowledge is really, it's in Canada, we'd say the best thing since sliced bread. It's the next best thing that's going to cause all, problems to go away, to find cures for everything. And while that has certainly been the case, and as we heard Kathy speak about some of the incredible gains in oncology, there are still some myths and misconceptions with what genomics can do. But what we do know is that it's very popular right now. There's a lot of interest in it. And so if nurses are positioned to be able to participate in that, they will be able to ensure that they're part of the change process, that they can support, safe and ethical and informed structures that move forward. And if nurses don't have the confidence and the competence to engage in these conversations, people will not necessarily see them as trustworthy colleagues. And so what we know from some of my own research in the past on collaboration, and certainly the work of others, is that to be a trusted colleague, meaning somebody will seek you out, they will listen to you, they will want to have your input, they need to see that you have confidence and competence in a subject matter. So we know that unless we do this important work around nursing and genomics, it would be very difficult for nurses to be these trusted colleagues. And globally, nurses have enjoyed a high level of trust. And so we want to make sure that that continues. So that's a big motivator for the work that we're doing here in Canada. And so as we know, credentials and in education, that's how we create the boundaries. That's how we demarcate our role as nurses. So that work is really important. So and that's kind of some of the background to what motivated the approaches that we used. And I think that's important for you if you're anyone in the room and globally who's thinking of activating or beginning an initiative to support nursing and genomics, whether it's a small project just where you work or a territorial or a national project, is thinking about that motivation behind the work. What is grounding the work? Because that will inform how you move forward. So that background was really instrumental in the approaches that we used in creating the Canadian Nursing and Genomics Initiative. So I'm presenting some of the work that we have done as a large team in Canada. And we came together. Initially, it was Lindsay Carlson and myself. Now she was a PhD student. Now she's a PhD. So Dr. Carlson and I really talked a lot about what we wanted to do and how we wanted to do it. And so we first clarified our aims, and then we built the team to help us meet those aims. So we wanted to raise awareness. In Canada a few years ago, this was not on the radar. Interestingly, it had been in 2005. There was a nurse, Mary Butteroff, who had tried to do some of what we're doing now, but she was way ahead of her time and had some difficulties just getting the traction. But I think trying again is also another important lesson. So we wanted to raise awareness. We wanted to create the necessary infrastructure, policy, education, curriculum. We want to support research, collaboration, and ultimately clinical innovation. So there on the right-hand side of the screen, you can see our team. And Canada, as many of you might know, is a very large country. So we have tried to have representation from across the country, but there aren't very many nurses doing work in nursing and genomics right now. And we try to meet all of them. And certainly the team here represents some of those nurses. So why an engagement framework? So as the slide said, the first step after we figured out what we wanted to do and what was grounding us, our first step was to create an engagement framework. And why would we want to do that? Well, having led a few national projects, I understood that it was important to have a consistent approach, that we wouldn't end up trying this, trying that it would be what we call concerted. So it would be organized, it would be framed in a specific approach so that people would count on us to do things in a certain way. So that consistent approach guides our action. It also, our framework, the way we created it, it was very important because by that time I had met Emma and Kathy, who had really explained that there was actually quite a lot happening in other countries. And so we wanted to make sure that we were building on the existing evidence and strategies. You just heard Kathy say, we don't want to be reinventing the wheel. So for us in Canada, because we're lagging behind some of the other countries, we couldn't waste time doing something that had already been done. Especially if it didn't work elsewhere, the chances are it wouldn't work here in Canada. So we wanted to be able to build off what was already happening. And we really wanted to, extend our networking, our collaboration, and the global reach of nurses. We knew that things were happening in other countries. We knew through the G2NA that a lot of great work was happening. So we really wanted to be sure that we were networking with experts and with people trying to do similar things to us so that we could learn from each other. Our framework also makes sure that we explore the context of practice. And in Canada, when we started this work, the pandemic was just starting. And I received a large research grant to look at the impact of the pandemic on collaboration and on clinical practice. So through that big project, I was acutely aware and continue to be of what the pandemic has done to the workforce, to the ways that people interact at work. And I think it's important that we consider that context regardless, but certainly as we move forward. And we wanted to make sure that we had supportive structures, really thinking about a strength-based approach as opposed to a deficit model. So we know there's a lot of work for us to do here in Canada, but we wanted to be focused on, well, what already exists that we can either leverage or that we can build upon. And it can feel very negative and sort of energy deflating if we focus just on needs. So it was this balance that we wanted to make sure that we had definitely identifying needs and the things that we had to do, but putting that in a framework of strength and building off what already happened. So we created a visual display of our engagement framework, just so that there would be these sort of the visual cues that would help us, you know, as we're engaging with others in this work, that they could recognize, you know, we have a logo, this is our framework, and we did a little play on DNA with it. And so the first time we used this engagement framework after we developed it was to identify the key priorities for nursing. So remembering how I had indicated, it's important that we are strategic, focused, and concerted. So the first is to really figure out what are the needs of Canadian nurses. And of course, other countries have done this. And we talked a lot about, well, could we not just do that, because these needs have already been identified from some of the people who are here at this conference. But when we considered the context and our culture in Canada, it was very important that we could say that these are the needs of Canadian nurses. So you'll see that they are similar to what has been already described in the literature, but so important to be able to be specific with that. And that has certainly helped us to gain traction when we can say, we used this process and uncovered the needs of Canadians. So our early work was really funded by our institutions where we work, members of the Canadian Nursing and Genomics Group. Luckily, our universities, Memorial University and Athabasca University, got behind this work and have been quite supportive. And Ontario Genomics certainly as well. So I'm going to talk a little bit about the framework and how we used it, hoping to give you some ideas of, again, these leadership strategies. So you've heard me talk already about nursing intra-professional collaboration. The other is that we used the diffusion of innovation. So that's a theory that I was quite familiar with. I had used it many times, and I don't have time to get into a big discussion of the theory, but one of the key sort of propositions of that theory is looking at the early adopters and the readiness to engage with change. So that theory helped us in particular to look for those early adopters, those opinion leaders, those people who already had some interest in engagement with genomics. Again, remembering that our approach here in Canada is a strengths-based approach. So when we can find those people, those early adopters, they are a strength that we can leverage, that we can work with. The other framework that is really important and continues to guide our initiative is the knowledge to action cycle. The reason we picked that is because it's a very good knowledge mobilization framework, but it is the framework that is used by the Canadian Institute for Health Research. So that is the granting institution that would fund our work, should we be so lucky to get one of these grants. So early on, aligning our thinking to those granting agencies we thought was important. The key feature of the knowledge to action cycle is really about thinking first and foremost about the knowledge user and the practice context. So you've heard me already talk about, the importance of keeping this on the ground where nurses, whatever practice they have, whether it's in research, policy, or at the point of care, at the bedside, it is important to think about the knowledge user and what their work setting is like. So those were the frameworks that guided us. And here's a visual representation that we use to reflect that nursing intra-professional collaboration. So we then, in our framework, we always look at what are the data sources, again, making sure that we're consistent with some of the underpinnings. So we always turn to the literature first, again, trying to build off what has already been developed. And so when we were looking at establishing the needs, the priorities for Canadian nurses, over and over in the literature, important needs are around education, around forming infrastructure and collaboration, and leadership competencies. So that gave us some good perspective. We did an environmental scan, again, anchored by the framework in terms of the practice context. So we used the assign tool, and that was developed by Emma Tonkin and her team. And that was very helpful for us to look at critical success factors. And we have a PhD student still working with us, Rebecca Puttister, and we supported her to try and develop a manuscript around this environmental scan. And it's under review right now, but that was really important and diligent work because it helped us know, that we had lots of need to develop that infrastructure, but it also pointed the way in some of the places where we had made some gains and that we could build off some of that. So expert opinion, again, we always want to be collaborative and collegial and use our network to not reinvent the wheel, but to really spring off the momentum of others. And it was Emma Tonkin and Kathy Calzone that were the first international colleagues that I spoke with. And when Kathy says to you, she mentioned at the end, reach out, she really does mean it and is a very excellent collaborator who knows what's happening around the world and can help sort of navigate and help other people find the needs that they have. So since then, we have gone on to develop very strong linkages with the international community. And I think you're going to hear more about that in the coming days. So we believe that knowledge mobilization between countries will really help us move forward. And our goal in Canada, one of the things that I often say when I meet with people that I'm extending our network, is that Canada wants to catch up, and then we want to be able to give back and take a leadership role. And we're still in the catching up phase right now. And so, and then the last is that we always look for firsthand accounts from nurses. It's always important before we do anything that we hear from the nurses who are actually going to be using this knowledge, that we can understand their needs, their barriers, the facilitators. So we bring those 4 knowledge sources together. And the first time we did it, it worked really well. We were able to have strong clarity on 6 priorities for action. And as I said, you will not be surprised, you will recognize these, but we can say that through our process, these reflect the needs of Canadians. Of course, not every Canadian nurse is going to have the same need, but those 6 needs now help us to know what we should be doing next. So all of our initiatives, since we developed the framework and identified these needs, aligns to this. So when we're applying for grants, whether small or large, when we're meeting with people trying to build our networks, we try to weave these needs in. So I'm just going to finish the presentation with a few lessons learned and then open it up for questions. So if you are thinking of engaging in a similar kind of initiative where you're raising awareness, engaging people, helping people to change practice, creating education, these are some of the strategies that may resonate with you. Whether it's big or small, we think that part of the strategy that has helped us is that we have a steering committee with geographical representation, that we have shared goals, and yet we have distinct and complementary backgrounds. So we have different abilities, so that we have people who have expertise in knowledge mobilization, people with expertise with clinical genomics, at the bedside, people with expertise in education, in research, and so on. So that helps us to facilitate the work. We've got these different perspectives, different skill sets. So when you're building your team, I would encourage you to think about, having a broad range of people from different areas with different skill sets. Building your network and your credibility is really important. And I think about those early days, 2.5, 3 years ago, when I would connect with people. I didn't have the same ease talking about what we wanted to do in Canada as I do now. So it took some practice, to be really clear and succinct. But even though I knew I wasn't always doing a super good job at being clear and succinct, I continued to build the network. So in probably the first year and a half of the Canadian Nursing and Genomics Initiative, every week I tried to meet one new person who could support our initiatives. And luckily, I know a lot of people, and I've been able to connect with national and international groups, which I think helps not just us in Canada, but helps globally. So one example is Dr. Michelle Acorn, who is the chief nurse for the International Council of Nurses. So she is Canadian, and I do know her. So early in our work, I connected with her, and then that helped her to connect with the international community. And she's gone on to do some really important work with G2NA, for example. So if you know people in your country that you can start to socialize these ideas with, if they have international connections, it can help the global reach of nursing. The other is the executive director of GA4GH is Canadian. And so I've been able to make connections with him and build that. So now I don't spend as much time networking and sort of building our framework, but I still at least once a month try to meet someone new, in a purposeful and intentional way to just keep the momentum going. So the other lesson learned that I think is important is to get buy-in from your national nursing organizations. For us in Canada, that took quite a bit of effort for the reasons that Kathy described already, that a lot of nurses, we were not educated about this in our program. And although genetic and genomic knowledge has been around for a while, it's still relatively new. And unless you happen to be in a work setting where this is being discussed, it is possible that you don't understand what nurses are supposed to do with it. And it's a complex knowledge form. And so it took a fair bit for us to get buy-in from our national organizations and provincial organizations, and that work continues. So I've already mentioned the importance of thinking about your granting institutions, because certainly you will need money to do these kinds of work, to do research, to host education events, and so on. Some of the last lessons learned is to identify these early adopters and leadership support. It's not always easy to have the momentum and to keep up the energy. But when you surround yourself with these early adopters and leaders that are understanding what you're trying to do and to support you, it does help keep the momentum. And we have tried to develop a social media presence. And I think that's something that we could do more of, certainly. But we did create a website. We try to create visuals to support the work that we're doing. And you heard how, Kathy and her team have created an image library as well. Images are really important to convey some of the work that you're trying to do. So, we've applied the framework now in other approaches. So I'm just going to quickly run down some of those. So we have a publication around some of the leadership strategies and describing the framework and how we used it, if that's of interest to you. We have hosted conferences and done a lot of webinars and presented at conferences. Really important to get the word out. We are just about to launch a Canadian study using the GGNPS that Kathy just spoke about. And as Kathy explained, it is designed to be modified. And so we did add questions to reflect the Canadian context, primarily questions around equity and diversity. That's very important to us in Canada right now. And so we really wanted to capture that with the survey. And because the GGNPS is in the public domain, we intend to put the GGNPS-CA into the public domain, with Kathy's assistance and her team and the G2NA, so that those of you who might want to use those questions would be able to build off that as well. Recognizing the need to develop leadership competencies specific to the integration of genomics, we are experimenting right now with a teaching and learning approach called globally networked learning, where we have students, graduate students in Canada, partnered with graduate students in Finland, doing an assignment together using the assign tool and developing a leadership strategy to address one area that could be strengthened. Really interesting. We're on our second cohort and have one more cohort in January, and then we'll be able to analyze that data. So we develop as many resources as we can to support learning, and these small knowledge mobilization grants, for some reason in Canada, there are a number of them, and they're not always that hard to get. So we try to get them and try to create whiteboard videos, infographics, different kinds of ways to support our work. And we continue as a really important strategy around this, this interprofessional collaboration. So some of our initiatives that we're moving forward with is Emma Tonkin and Kathy Calzone have joined the Canadian Nursing and Genomics Initiative to apply for a Policy Catalyst grant. So an important piece of infrastructure, as I mentioned, is to have policy, because those are the public accountability statements. And so we are hoping to be successful in getting that policy grant. And we'll certainly share any knowledge that is generated from that. We have submitted a letter of intent for quite a large knowledge mobilization grant through the Ontario Institute for Cancer Research, where the foundation of that grant is really building off much of the work that has happened in the United States that Kathy has described to you. Some of the existing strategies with the MINC, using the GGNPS-CA, some of these things that already exist, showing that we're building from the work that has already happened. And a lot of knowledge mobilization strategies are, and digital research strategies are part of the survey that I mentioned that we're doing Canada-wide. So lastly, just some recommendations and then hopefully some discussion with you. Is, we think it's important, and it has been important to us to have this engagement framework that we constantly go back to make sure that we're anchored and that we're focused. We are trying very hard to use a strength-based approach. So really avoiding the deficit narrative. And I've just applied for a small knowledge mobilization grant that will help us connect with stakeholders to think about when we get the results of the GGNPS-CA survey, we expect to get the results that others using that survey have, which is that nurses don't have an overly high genomic literacy level. And we want to think a lot about how to present that in a way that doesn't make people feel that they lack competency. And so we hope to get a small grant to be able to do some strength-based focus groups with nurses to figure out how we can present those findings in a positive way that show capacity, show ability to move forward. And the other that we're constantly doing is contextualizing this work in the pandemic and the post-pandemic context. As we all know, the pandemic has been very hard on nursing, and there are significant nursing shortages around the world. And so how do we do this work when nurses are working short-staffed, when people are quite stressed and burnt out from all of the pandemic-related experiences? So some of the stakeholder engagement strategies that I just mentioned will be very important given that context. So I'll stop there and ask if you have any questions.
Yes, if it's possible, I would like to do a question.
Sure.
Yeah, it's been a nice talk, and it's incredible the work that you are doing at the national level and all these collaborative works at the international level. And you have pointed out that education is key, as all the talks that are scheduled at these international days. And my question is that this education is mainly focused at the professional level, I think, at the clinical level. And you have also talked about collaborative study with Finland, I think, with graduate students. And have you focused, or is there any project just focused with undergraduate students? Because I think that the earlier you start with these education programs, the better these professionals will be at the end.
Absolutely. And so our key collaborator on this policy grant that I just mentioned is the Canadian Association of Schools of Nursing. And we are definitely working to develop sort of education competencies. And we did manage to get a new specific competency in the standards for undergraduate nursing education, specific to nursing and genomics. So that kind of policy work is really important, because if there isn't a policy or a standard or a guideline that says this has to happen with an accreditation process that goes with it, those are the kinds of strategies that really, in Canada anyway, accelerate. So now we have that competency statement in the undergraduate education requirements. There will be an accreditation standard that goes with it. And so those are coming out shortly, and that will definitely help our work. I'm doing a webinar in February with the Canadian Association of Schools of Nursing. And so that's where nursing faculty come to those webinars, where we will begin to talk about how to do this. You know, what are some of the strategies? And we have a lot of work to do in Canada around creating curriculum supports. And I don't know if it's unique to Canada. I think it's not, but there is a sense that we can't just take something from another country and apply it in Canada. We have to Canadianize it. And so we have a lot of work to do to create teaching resources. And fortunately, you know, some of that work has been done in other countries that we can use as a guide. But that work definitely has to happen. So that's some of where we're going, completely agreeing that this needs to be in the undergraduate program. And part of what we have to clarify is the nurse's role with genomics. And so we're still, you know, working on some of that. I think globally that's something that we're working toward. So I don't know, Anna, if that's answered your question or if you have a follow-up question.
No, that's okay. That's great. You are working a lot on it, and I hope that all other countries can take these strategies and just to try to introduce them into our universities. So thanks a lot.
Thank you.
Would like to ask a question before we pass to the audience? No? Anyone in the audience who would like to ask a question? Hello, Jacqueline. It's Arya. Yeah.
Hello, Arya. My globally networked learning colleagues there in the room with Mari.
Yeah. Thank you for your presentation. It was really nice, and I learned a lot about your work at what you are doing there in Canada. But what do you think about the time frame that you will get that curriculum work done in what is your opinion or wild guess about that?
It's very difficult. So in Canada, every individual faculty creates their own curriculum. We have what's called academic freedom. So, you know, courses exist, but we decide as an individual how we approach that. Everything eventually has to line up with what we call the entry to practice competencies, but we don't have a national curriculum. We don't have a provincial curriculum. You know, we have these competencies and schools have to teach to them. So we can create resources and guidelines for people, but we cannot tell people what to teach. So what we have to do first is we have to help nursing faculty, nursing educators see the importance of this and be interested in it. And for any of you who are as old as me, you will remember we went through something similar with pain relief strategies, back in the 90s, where we had to change our whole thinking on the way that we conceptualized pain relief and the treatment of pain. So we've been down these roads before. Tobacco cessation was another one. We've been down these roads before where people teaching nursing have had to rethink mindsets and the way that they teach and approach things. So I think that that's where we're at right now. And we would like to develop supports, example curriculum, example sort of teaching structures, and then people will have to make it their own.
How we educate educators.
How do we?
How do we educate the educators, teachers?
Yeah, and I think in Canada, through webinars, through conferences, we have now a second article that will come out in the Canadian Journal of Oncology Nurses. We try to write articles, certainly, in the traditional peer-reviewed way, but we also try to write articles that are very practical, this is what you can do with this. So those are ways that hopefully we can pique people's curiosity. I think that, we've seen some interesting examples. Emma Tonkin and her group did that seminar series that we're really excited to hear some of the results about that, where nurse educators and faculty came together. I think it was in the summer to learn how to teach genomics. Kathy Calzone and her team had a really interesting webinar series supporting nursing and genomics and oncology. And the Tiger Network coming out of Vanderbilt University in the United States, they brought together, a large number of nurses, I think doctor of nursing practice nurses, to figure out how to teach some of this. So it's that webinar, and I think we'll get to a tipping point where, people will obviously have to teach themselves as well. But those kinds of structures, I'm looking at them very closely because I think they would work for us in Canada. We've used similar things. Another example is in Canada where we had to rethink the way we were approaching teaching gerontology. So we've got some examples in Canada of how that happened. So I'm really interested in what they're doing, what Emma and Kathy are doing with those initiatives and what the Tiger group is doing, because I think there's some good model there that would benefit us in Canada.
Hi, Jacqueline. Thank you very much to stay here, or not here, but online. And I have a question. In Spain or in Catalonia, our nurses don't have enough information, enough courses or enough lesson about genoma and genetics. And if these nurses want to start learning, what kind of items do you think that's the best to start learning about genoma or genetics?
So I think that there are some incredible resources, again, that Emma and Kathy have developed, through Health Education England, through the Oncology Nursing Service. So as Kathy said, some of those resources are oncology specific, but a lot of them, it's some of the foundational knowledge that people need to have. There are good resources there. I think that, but even once nurses identify that this is important to them. So for us, and from my perspective, and we may not, the world has moved on since we started this work. That's another important thing. But for us, we're still trying to help nurses understand the importance of this. Our view is that once nurses understand that it's important, what it could mean to them and their patients and the communities that they provide care for, they will then start to seek out education based on their practice needs. So, all nurses have requirements for ongoing competence. So early work is helping nurses see that there's a role for them in this work, and the role is going to vary depending where they work. And so then it's, once they've identified the need, it's to try to have the resources ready. And I think that, getting access to some of the resources, as I said, that exist in the UK and in the United States would be really a good place. They haven't been Canadianized, but it's going to take a long time to develop the resources, as it did in the US and the UK, but those are definitely good resources.
Gotcha.
Is there any more questions before we close down? Thank you.
Okay, thank you very much, Jacqueline. It's a pleasure to listen to your presentation. And that's all for today, partners and attenders here or in your house. Tomorrow starts the new day at 9:30 a.m. See you tomorrow. Thank you very much.